We're making tentative progress on one of the world's most dreaded disorders, Alzheimer's disease. It's estimated that more than 6 million Americans, most of them over 65, may have Alzheimer's. But a couple of recent drugs are drawing attention for their potential to at least make a little difference in the dementia brought on by Alzheimer's. One recently won full FDA approval. And could there be other therapies that enhance the actions of those medications, or lifestyle enhancements that could slow the progression or help prevent Alzheimer's disease in the future? One therapy that's being looked at is listening to and making music, and it's having a surprising effect. Fox 11 News In Depth starts right now. Hello, everyone. I'm Hal Eisner, and this is Fox 11 News In Depth. Alzheimer's is currently ranked as the 7th leading cause of death in the United States and is the most common cause of dementia among older adults. But just recently, a new Alzheimer's drug meant to slow the progression of the disease was granted full approval by the Food and Drug Administration. Dr. Suzie Bash, a neuroradiologist and medical director at RadNet, is with us right now. Good to see you, Suzie.
Nice to see you as well, Hal.
All right, so you and I have been talking a little bit about this drug over the last few weeks, and you're a pretty good cheerleader for it.
I am. I'm a big proponent of it. It's been an exciting summer for Alzheimer's disease.
What is Leqembi?
Okay, so Leqembi is it's a monoclonal antibody, and it does a great job of slowing the progression of disease for Alzheimer's. 27% slowing of the progression of disease.
But let's be clear here, this is not a disease that has a cure.
That's exactly right. There is no cure. But for the first time, we have full regulatory approval of a disease-modifying therapy. And so Alzheimer's disease is, again, a progressive neurodegenerative disease. It's characterized by two things: beta amyloid plaques and neurofibrillary tangles in the brain.
All right, define that.
Okay. So basically, they're sort of like toxic proteins that accumulate in the brain of patients that have Alzheimer's disease. And this
is it like plaque?
It's plaque, yeah. So
okay.
Beta amyloid plaques and neurofibrillary tangles. And this medication actually does an excellent job of clearing those plaques from the brain. So unlike other things like people use Aricept, that's a cholinesterase inhibitor, that treats the symptoms. But this actually treats the underlying disease process. It removes those beta amyloid plaques. And that's why it's so exciting. And the other component is, right after the FDA granted traditional approval, CMS, which stands for the Centers for Medicare and Medicaid, immediately affirmed that they were going to cover this drug broadly.
And that's always been a big issue, is will insurance cover it?
That's exactly right. So this was really a pivotal step in the pathway to allowing drug access to the millions of people that are suffering from this.
But I want to get back to this thing about plaque, because we have all kinds of places in our bodies where plaque builds. And you can have it in an artery, and then you can have a heart attack, or you can have it in the brain, and then you can have a degenerative disease like Alzheimer's, right?
Well, it's a different kind of plaque. So the plaque that you were just mentioning is atherosclerotic plaque that you get in the arteries. This is actually, the beta amyloid plaque is actually outside of the brain cells, in the space between the cells. The neurofibrillary tangles are actually in the cells, but it's different from atherosclerotic plaque.
But we're talking about a lot of big words. It may be hard for a lot of people like me that didn't go to med school to completely understand. So what are we doing here? We're going in with a fill in the blank, and we are doing what to clean it out?
Right. So we're basically giving this medication is, again, a monoclonal antibody, and it attaches to those beta amyloid plaques and helps clear that from the brain, and it does a really good job.
It's like a vacuum cleaner.
Exactly.
Kind of grabs onto it and pulls it out.
And we can see that on an imaging study called a PET. That stands for positron emission tomography, amyloid PET. And you can see before the patient takes the medication, they've got a lot of plaque in the brain, and then after they've taken it, that plaque is removed. And after that plaque is removed, that's when we see the slowing of progression of disease.
Why is it we're just hearing about something like this? I mean, it seems to me, if we understood the science of how something might be pushed out, then this could have been done before?
Yes, well, that's a good question. We've been working at this in fact, there's the National Institute of Aging is funding over 450 trials on dementia. So there's been a lot of work here.
Over decades?
Over decades. But this is the first time that we are getting medications that are actually working well in terms of slowing.
So we've had things in the past, they just haven't necessarily been effective.
They haven't been as effective, exactly.
And so now we have something that's effective, it's covered by insurance.
Right.
It's approved by the FDA, and that's why you're a cheerleader.
Well, yes. I mean, we just have recently published the results of this trial at the very end of 2022 in a new drug that we hope will get approval probably by fall or winter called donanemab, made by a different company. That slows progression by 35%. And they just published their results in July. So now we have two medications that we are seeing are actually making a big difference.
I was just looking at my notes about donanemab, and I'm noticing here that scientists at the Alzheimer's Association International Conference in Amsterdam seem to have had some pretty high hopes for this particular drug.
Absolutely, yeah. So that slows progression by 35%, and that's at the 18-month mark. But at the 1-year mark, 50% of patients with Alzheimer's had no progression of disease at all. And when you think about how devastating this disease is, when we catch it in the early phase with this medication, that could mean a whole year of them still being able to drive their car, do their own finances, and most importantly, have meaningful interactions with their loved ones.
This is a medication, though, that is reactive, not proactive, right? So I guess my question is, is this a step along the way to finding a proactive medication?
Right. So there are actually Alzheimer's preventative trials that are in progress right now. But this is what we have on the table, and it is making a difference. And these drugs, there are some side effects that you can get with these drugs.
Like what?
Well, it's called, the main one that you hear about is called ARIA. That stands for amyloid-related imaging abnormalities. And that can manifest as brain swelling, which we call edema, or brain hemorrhages, which are like microbleeds in the brain.
And then you get a stroke.
Well, not necessarily. It sounds very scary, but the great news is that the edema tends to almost always resolve over time. Yes, and like with lecanemab, symptomatic ARIA only occurs in less than 3% of patients on the drug.
Right.
And you have to, as you mentioned, this is a lethal disease, and so I can tell you from my perspective, if it was me or one of my loved ones, I would want to take the medication because, again, I would rather have that slowing of the progression of the disease, even if I did have a side effect. And then if you do develop the side effect, which, by the way, you pick up on MRI, and we can also use artificial intelligence to help us pick that up as well. But if you do have that, you would just pause the medication, repeat the MRI in a month, and then you can continue if it's gone away.
Okay, very good. So if you have any questions about this, be sure that you check with your doctor and say, I heard Dr. Bash talking about this on Hal Eisner's show, and I think it sounds interesting, and what can you tell me about it? And bada boom. Dr. Bash, good to see you.